Dogs and cats.
Welcome to our channel. Today, we're diving into a crucial topic for every cat owner: the 5 deadly viruses that can pose a serious threat to your feline friend. Understanding these viruses is essential for keeping your cat safe and healthy. Let's explore these viral threats, their symptoms, and how to protect your pet. Alright folks, let's talk about a tough one right off the bat: Feline Infectious Peritonitis, or FIP. This disease is one of the most challenging and heartbreaking conditions that can affect our feline friends. This one is a real heartbreaker, and it all starts with a mutation of the common feline coronavirus. This virus is quite prevalent among cats, but it usually doesn't cause any significant harm. You see, many cats carry this coronavirus, and most of the time, it doesn't cause any serious issues. Cats can live their entire lives without ever showing symptoms of this virus. But in some cases, this virus mutates, and that's when things get really scary. This mutation transforms a relatively harmless virus into a deadly one. This mutation leads to FIP, and it's like flipping a switch from a mild cold to a raging fire in your cat's body. The virus begins to attack the cat's immune system, causing severe inflammation. It causes severe inflammation, and it can hit different organs, making it even harder to diagnose. The symptoms can vary widely depending on which organs are affected. You might see your cat lose weight rapidly, becoming a shadow of their former self. Their belly might swell up like a balloon, a condition known as abdominal effusion, which is a telltale sign of the wet form of FIP, and they'll have a fever that just won't quit, no matter what you do. This persistent fever is often one of the first signs that something is seriously wrong. Now here's the really tough part. FIP is often a death sentence. The disease progresses rapidly, and by the time symptoms are noticeable, it is usually quite advanced. It progresses fast, and by the time you see the symptoms, the disease is often quite advanced. This makes early detection incredibly challenging. However, don't lose hope just yet. There are some treatments available that can help manage the symptoms and improve the quality of life for your cat. There are some antiviral medications out there that can buy your cat some time, and in some cases even lead to remission. These treatments are not a cure, but they can provide a glimmer of hope. And in some rare cases, cats have been known to go into remission and live a relatively normal life. These cases are few and far between, but they do exist. But we gotta be real here. The odds are stacked against us with FIP. The disease is aggressive and often resistant to treatment. What can you do? Early detection is key. The sooner you catch the symptoms, the better the chances of managing the disease. If you see any of these symptoms, get your cat to the vet as soon as possible. Don't wait, because time is of the essence. Time is of the essence here. The faster you act, the better the chances of getting your cat the help they need. And remember, knowledge is power. Educate yourself about FIP and other feline diseases. The more you know about FIP, the better equipped you are to spot it early and fight for your furry friend. Stay informed, stay vigilant, and always keep an eye on your cat's health. Your awareness could make all the difference in the world. Next up, we're tackling Feline Leukemia Virus, or FeLV for short. This virus is a significant concern for cat owners and veterinarians alike. This virus is a sneaky one, folks. A real silent stalker. It can lurk in your cat system without showing any immediate signs, making it difficult to detect early on. It attacks the immune system, leaving your cat vulnerable to a whole host of other infections and diseases. Imagine your cat's immune system as a fortress. FeLV is like a Trojan horse that weakens the walls from the inside. It's like taking the bodyguards away from a celebrity. They're left exposed and vulnerable. Without a strong immune system, your cat is at risk for various health issues. FeLV is spread through close contact with infected cats, mainly through saliva, blood, and other bodily fluids. This means that everyday interactions between cats can be a potential risk. Think about how cats interact: sharing food bowls, grooming each other, even just bumping noses. All of these can be potential transmission routes. It's a social virus, thriving in environments where cats are in close contact. And here's the kicker: some cats can carry the virus without showing any symptoms, silently spreading it to others. This asymptomatic phase can last for months or even years. Now let's talk about the signs. Recognizing the symptoms early can make a significant difference in managing the disease. Cats with FeLV might become lethargic, lose their appetite, and just not be themselves. You might notice them sleeping more than usual or showing less interest in their favorite activities. They might get infections more frequently or have trouble shaking them off. Respiratory infections, skin infections, and dental issues are common in FeLV-positive cats. And sadly, FeLV can lead to cancer in cats, making it even more dangerous. Lymphoma is one of the most common cancers associated with FeLV. The hard truth is there's no cure for FeLV. Once a cat is infected, the virus stays with them for life. But don't despair just yet. There are ways to manage the condition and improve the quality of life for infected cats. With proper care and management, infected cats can still live relatively happy lives, especially if the virus is caught early. Regular vet visits and a healthy lifestyle can make a big difference. We're talking about supportive care, managing symptoms, and keeping their environment as stress-free as possible. This includes a balanced diet, regular exercise, and mental stimulation. Prevention is the best medicine here. Keeping your cat indoors can significantly reduce the risk of exposure to FeLV. Make sure they're vaccinated against FeLV. Vaccination is a crucial step in protecting your cat from this virus. And remember, regular vet checkups are crucial for catching any potential problems early on. Early detection and intervention can help manage the disease more effectively. By staying vigilant and proactive, you can help ensure your cat lives a long, healthy, and happy life even in the face of FeLV. Chapter 3. Let's talk about Feline Immunodeficiency Virus, or FIV. This virus is a significant concern for cat owners and veterinarians alike. Now, this one often gets called feline AIDS. And while there are some similarities to the human immunodeficiency virus, it's important to remember that FIVV is specific to cats and cannot be transmitted to humans. This distinction is crucial for understanding how to manage and care for cats with FIV. Just like FeLV, FIV attacks the immune system, making cats more susceptible to other infections. This means that even minor illnesses can become serious health threats for an FIV-positive cat. It's like poking holes in their armor, making it easier for the bad guys to get in. The immune system, which is supposed to protect them, becomes compromised, leaving them vulnerable. And just like with FeLV, cats with FIV might not show any symptoms for years, making it even harder to detect. This asymptomatic phase can last for a long time, during which the virus quietly undermines their health. So, what are the signs? Recognizing the symptoms early can make a big difference in managing the disease. Well, cats with FIV might experience weight loss, which can be gradual and sometimes hard to notice until it becomes significant. Have a poor coat condition, which might look dull or matted, indicating their overall health is declining, or suffer from persistent infections that just won't go away. These infections can be bacterial, viral, or fungal, and they often recur despite treatment. They might also develop swollen lymph nodes or experience dental problems. Dental issues are particularly common and can include gingivitis and stomatitis, which are painful and can affect their ability to eat. Basically, any sign of their immune system struggling could be a red flag. It's essential to monitor your cat's health closely and report any changes to your veterinarian. Now here's the good news. FIV is not always a death sentence. With the right care, many FIV-positive cats can live long, fulfilling lives. While there's no cure, many cats can live long and healthy lives with proper care and management. This includes a balanced diet, regular exercise, and mental stimulation to keep them happy and healthy. This means regular vet checkups, which are crucial for early detection and treatment of any health issues that arise. Early treatment of any infections to prevent them from becoming severe and to maintain the cat's quality of life. And providing a stress-free environment to support their immune system. Stress can weaken the immune system further, so a calm and loving home is vital. Preventing FIV is all about reducing the risk of transmission. Understanding how the virus spreads can help you take the necessary precautions. Since it's primarily spread through bite wounds, which often occur during fights between cats, minimizing aggressive interactions is key. Keeping your cat indoors is one of the best ways to protect them. Indoor cats are less likely to get into fights and are generally safer from many other dangers as well. Spaying and neutering your cat can also reduce their urge to fight, as it often decreases aggressive behavior associated with mating instincts, further minimizing the risk of infection. By taking these steps, you can help ensure your cat lives a long, healthy, and happy life, even with FIV. Chapter 4. You ever get a cold that just knocks you out? Well, Feline Panleukopenia, or FCV, is like that for cats, but with a whole lot of extra unpleasantness thrown in. This virus is one of the main culprits behind upper respiratory infections, or URIs, in cats. It's highly contagious, spreading like wildfire through the air and on contaminated surfaces. Now, FCV can manifest in a bunch of different ways, which makes it a tricky one to diagnose. Some cats might just have a mild sniffle and a bit of a cough, while others can get hit much harder. We're talking fever, loss of appetite, ulcers on their tongue and gums, and even pneumonia in severe cases. One of the telltale signs of FCV is the calicivirus limp, where cats develop painful ulcers on their paw pads, making it difficult to walk. Imagine having blisters on your feet. Not a fun time for anyone, especially our feline friends. The good news is that most cats recover from FCV with supportive care. This might involve pain relief, fluids to prevent dehydration, and good old-fashioned TLC. However, some cats, especially kittens or those with weakened immune systems, can develop more serious complications. Vaccination is key in the fight against FCV. While it might not completely prevent infection, it can significantly reduce the severity of symptoms and help your cat bounce back faster. Chapter 5. Now this one's a real gut-wrencher, folks. Feline Panleukopenia Virus, or FPV, is highly contagious and can be deadly, especially for kittens. It's often called feline distemper, and it attacks rapidly dividing cells in the body, particularly those in the bone marrow, intestines, and immune system. FPV spreads through direct contact with infected cats, as well as through contaminated feces, vomit, and even fleas. It's a tough one to eradicate because it can survive in the environment for a long time, just waiting to infect a new host. The symptoms of FPV are nothing short of heartbreaking. We're talking severe vomiting and diarrhea, often with blood, leading to rapid dehydration. Cats might become lethargic, lose their appetite, and develop a high fever. In severe cases, FPV can cause neurological damage, seizures, and even death. Now here's the good news. FPV is highly preventable with vaccination. The FPV vaccine is considered a core vaccine for cats, meaning it's essential for all cats, regardless of their lifestyle. So, if you're a responsible cat parent, make sure your feline friend is up to date on their FPV vaccinations. Early detection and aggressive treatment are crucial for cats infected with FPV. This often involves hospitalization, intravenous fluids, antibiotics to prevent secondary infections, and anti-nausea medications. Even with treatment, FPV can be a tough one to beat, but early intervention definitely increases the chances of survival. Thank you for watching our in-depth look at the top 5 deadly viruses that can affect your cat. Remember, regular veterinary care and vaccinations are crucial in keeping your feline friends safe. If you notice any symptoms or have concerns, consult your veterinarian immediately. Don't forget to subscribe to our channel for more important information and tips on pet care. See you in the next video.